Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching that earwax removal video today. I promised to only do the intro once. I'm sorry about the mistake I made last time and leaving the kind of unedited version in there. If you haven't come across our channel before, we post new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time. So if you're not subscribed already, then please consider subscribing. So just to give you a little bit of background as to the patient that's coming through in this video today, we've got one patient in the video, lovely gent, came through feeling really blocked up in both ears. Does have a little bit of history with ear, nose and throat. He's had to have a skin removed from his ear canal surgically before, just because it had overgrown the canal and blocked it up. So he's come through today feeling really blocked up, and we're going to remove his wax for him. So without further ado, I'm going to put my glasses on so I can see what I'm doing, and we'll switch this over. So this is the patient's first ear here. So what you can see is we've got some really soft wax here right at the entrance to the canal. So we're just going to use the standard size ulnar tube here to go in and just gently remove this initial section of wax here. So we're getting rid of all the looser bits. Right in the center, you can see there's a color difference in the wax. It's gone from this light golden to this much darker color, and that's the harder section of wax we're pulling away now. So that's come away, nice big plug there. And if we take a look just behind that, so we'll just take away that little bit there at the entrance, you'll see we've got this really soft golden colored wax sitting behind it. So we're just going to use the standard size ulnar tube here just to remove those pieces of wax, just slowly take them off the canal, working our way very gently down this ear canal. But watch what happens when we come to this next section, just ahead now. As we get a grip on this centralized section here, and it starts to come away, watch what happens. You can start to see a little bit of skin. Now that shouldn't be there. We should still be this should still be ear canal at the moment. But as we get a grip on this bottom section just here, watch, it peels away and reveals this skin that's overgrown the canal. So this is something called a false fundus. So basically what we have here is the skin of the ear canal has actually grown, and instead of migrating along, actually grown into the canal and connected up, and it still has its own blood supply. So this is living skin, not the normal sort of dead skin blockages we take away, blocking that ear canal up. So it forms almost like a second eardrum or a wall, in this case about a third of the way into the ear canal. There will be ear canal behind that, and you can't remove that with suction. Because it's got its own blood supply, you need to surgically remove that. So we've had to refer this patient back to his ear, nose and throat consultant. That's certainly one of the reasons that he's feeling quite blocked up on that side. The more than likely they'll send him in for a scan just to see exactly what's going on behind it, and if it's feasible they'll remove that surgically for him. That's the surgery he had to have done years back, and the consultant at the time did say you are very likely to get this coming back again, but it had crept up so slowly on this patient he didn't actually realize it had happened. So he's going back to see his consultant to get that removed then. So this is the second ear. So what you'll see here is we've got quite a narrow entrance to the canal. We're using the standard size ulnar tube here. We've got a good grip on quite a hard section of wax here, just trying to bring this forwards. It's a really difficult shape because the entrance to the canal has collapsed. So we've ended up with this kind of oval shape here. And what we're doing then is we're trying to kind of get this rounder piece through an oval gap. So as you can see, the suction then sometimes can't hold on to it tight enough. You can hold the suction onto something and the suction will build, but only up to a certain degree. And then if you try and pull it out, it just breaks the suction and you lose that grip. So we're going to switch to the Jobson horn now. Just bending over the top of the wax, just slowing this piece down here. Just slowly bringing this forwards. There we are, it's on its way out there. Perfect. You can see that initial front section of wax, which was quite hard. As soon as you break through that, you get this real clay type wax sitting behind it. So you actually see that with the Jobson horn, we've just put a groove, a channel down that wax. So we know this isn't going to be particularly easy to remove because this type of wax isn't the easiest to remove with either suction or the Jobson horn here. So we're just going to have to keep sort of chipping away at this. What I'm trying to do is run it down that little groove in the center to try and get to the harder pieces, which usually accumulate around the outside edge of the wax closest to the canal walls. And sometimes, if you're lucky, you'll get a grip. You'll be able to see that groove there really clearly. You'll be able to get a grip on that section. So now we've kind of created this groove. What I'm going to try and do with the suction is try and bend these two sides in. Now, because the ear canal is quite collapsed, we have to use the endoscope to hold open the canal. because obviously with the endoscope, the tool, you've got something in each hand. Now you can sometimes use what's a little conical device you pop into the ear canal to hold it open, which is great if you're using loupes or an ENT microscope, because you can hold it with just one hand and you can use the other for the tool. But when you're using an endoscope like this, because both hands are occupied, you have to use the endoscope to use it. So we just tend to hold it open slightly to get to those rear pieces there. So you can see I'm working this wax up and down at the moment, trying to free it up from the canal walls, because you run the risk when you use the Jobson horn and this clay sticky wax like this of pressing the wax against the canal walls, which causes a few more problems. So as you can see, it's quite misty in here because as soon as we take the suction out, we've got a lot of moisture in the canal there. So as soon as we're using a different tool, you can see it just kind of, the moisture starts to build up a little bit. Trying to sneak over the top here. Now, don't forget, we don't know how far back this goes, and it's certainly something that somebody brought up in the comments recently, saying, do you ever worry that you're going to hit the eardrum with a Jobson horn? Well, we always try and be as careful as we can with the Jobson horn, and we don't try and use it if we think we're going to be deep. You've got certain kind of markers within the canal which give you a good indication of how deep you are. So you've always got a rough idea, where you are within the canal and how far away from the eardrum you are. But you've always got to be careful, especially with the Jobson horn. You can sometimes get a little bit of bleeding, which you can't help in some patients, unfortunately. Just even the slightest scratch on the skin is going to cause a little bit of bleeding in there. We're always really conscious of that as well with our patients. So we've got the standard size ulnar tube back in here at the moment. We've taken another big groove out of the center. We're just pulling this up into the middle here, just to loosen this away again. I haven't done many, I know I did country shout outs in the last one. They were just so many. I'm going to say hello to the world, okay? But I will say hello to Wales, okay? Obviously that's the country I'm in now. England, Scotland, and Northern Ireland. So basically everyone in the UK, okay? I'm going to say hello to everybody because everyone in the UK said, give a shout out to us. So I'm just saying hello to everyone. So you can see now we've got this really clay type wax. Can you see how it's stuck to the canal walls, ceiling, bottom, left canal, right? It's just stuck everywhere basically. You can see what I'm doing now is I'm just trying to slowly push along the front end there. Sometimes you'll break little bits off that will get sucked inside the machine. But it's just kind of, it's like Play-Doh, that kind of consistency. So you can imagine as you're kind of pushing it, it kind of molds and bends towards the canal and forms the shape of the canal then. So we've got a good grip on a piece that's just a little bit looser at the front end. So we'll get rid of that. There we are. It just came away with the suction tube. We've got a harder section. See the color difference at the bottom there? It's much darker. So that's a much harder section of wax. It's dried out just a little bit more. You can see the pinkness to the canal walls there. And this kind of white layer formed to the right-hand side. You can just see a glimpse of it there. That's all the kind of dead skin that's been trapped because this wax has been stuck to it. It hasn't been able to come away. So I'm trying to hold on to this section to bring it forwards because what's happening at the moment is when I'm trying to get the Jobson horn in, if I do it sideways on, it's probably easy to see. You've got the angle to the Jobson horn. We're trying to get above this section, but what's happening is it's just clipping it and it's pushing the wax further in. So I'm trying to bring it forwards with the suction so then I can go behind it with the Jobson horn. There you go. You can see we struggle to get behind it again. So I'm just going to try and take that section through the center and this right harder material. There we are. See it's sliding around the canal. There we go. So that's come away there. I was hoping that would bring a little bit more from further back, but it didn't really. Very, very small gap just above this this sticky clay type wax. Just managing to get behind it, but it's not pulling that section forward. It's just taking that top end. We'll see if we can just get behind that again. There we are. It's just pulling down from that top section. I think it's just taking that front end of the wax off again though. Let's wait for this to come all the way out. There we are. And still aiming for the same spot. You can see it gets really, really misty in here. So obviously if you lose the visual like that, you've got to be really careful. Now we're only using it just at the entrance, the surface of the wax more than anything else. Just taking away the bits I can see here on the outside edge. And just trying to push down. I'm trying to get a good grip on that bottom section. We've got to be careful though, because if we get too deep, we can scratch the canal. There we are. Just got a nice bigger section away there. But you can see it's just such a dense material in here. You can see that as soon as you put the suction tube in, the moisture disappears from the canal like that. So your visual comes back really easily. And I like to switch between tools with this type of wax, just because you can tidy up the edges. You can get rid of some of the bits and pieces that are blocking your view. We can reposition the wax, which is really helpful when you're using these tools as well. So you can see I've actually spun and loosened off that right hand side of the canal wall there. So we're just pulling this around to the center. What I'm doing is I'm bringing this forwards and lining it up ready for the Jobson horn again. So you can see we've spun it, we've created a little gap at the top. So I'm hoping if we, you see, this is what I mean about you've got to try and get that gap. If you don't, as you can see here, what happens is the wax is spun forwards, and then the back sections come up, which isn't really helping us here. But I'm putting a lot of pressure on the top here to try and bring this out. But it just broke those hard pieces away at the front end there and squashed a lot of this wax down at the base of the canal. So I'm just going to lift that back up now using the Zollner tube. We've got this, this kind of narrow section at the bottom of the ear canal there. There we go. It's freed up. It's moved a little bit. So you can see how by using the Jobson horn, it actually stuck it and compressed it against the canal wall there. So then using the Zollner tube lifts it back up and just attaches it. So you get a bit more free movement to it. You can see I'm trying to wiggle this out. I'm wiggling my socks off trying to get this out. It's just not working. So we're going to go back in now with the Jobson horn. Just did not want to play ball, this wax. So you can see we're just bringing this forwards, just trying to roll. See, we just knocked it back a little bit. It's so frustrating. We're pressing down into the center of this wax, hoping to get a grip on this bottom section. It took some of that harder wax away. And what you can see there, where it's just scratched, the edge of the Jobson horn just scratched the ear canal. So we've got a little bit of bleeding there. It's literally just taken a little groove into the skin there, but the blood vessels are so close to the surface that you end up with this tiny little bit of bleeding there. So we've got it wedged in the outer part of the ear canal. We really want to get this last bit away. You know, if you do get bleeding like that, you're always checking with the patient, make sure they're okay. That would feel like a very quick pinch or a very quick scratch in the canal, that sensation. I'm trying to pull this last section away. We've got a good gap there. Let's get behind it, bring this forward, just bring it down out of the canal. It got stuck in the bowl of the ear there. I couldn't pick it up with the Jobson horn, which is what you're going to see as I lift this up. There we are. So that's what we removed. So that was the kind of offending piece. You can see where we just got a little scratch to the canal there. Look how sort of there's a lot of moisture in that canal there. So you can see just how misted up that got. So we're just using the standard size on the tube here, just on the back end, just to take the moisture out of the canal so we can get a good look at the eardrum. We're going to switch to the fine end, which is going to help us to, you can see we're holding that canal open to be able to get to these pieces. Just going to take a couple of these little dry sections away. The bleeding you can see it stopped already. It's more like a rash, almost like an abrasion really, where you run over the top of it with a Jobson horn. The ear canal will heal itself. There's not a tremendous amount of bleeding in there. It's literally just the top end. So that will heal itself. Patient will keep this ear dry probably for about the next 24 hours, which will help to stop any risk of infection. I've just turned the brightness up a little bit on the endoscope here, just to get a good look at this last piece. We've got this little bit of wax that's stuck in the top corner of the eardrum. I just want to remove that. I don't want it to stay there because it can cause a few problems if it does kind of hang around this. We're just going to take this off. There we are. Lovely. And just take that little bit of dry skin at the top there away. Slowly, there we go. And we'll take a good look at that eardrum. There we are. So the eardrum looks nice and healthy. So this is what we removed. So we've got 3.5 centimeters there. Oh, let's go around the corner of my camera. 1.5 inches. So you can see quite dark material in there as well. You know, it's kind of that slightly older material you can see. So I'm just going to go back to, I'll take my glass off so you don't get blinded by the lights. Yeah, so basically what we had was this false fundus occurred on the one ear canal. The other ear canal was looking, you know, really dried out in places. This really sticky, thick clay type wax as well to remove there. Very difficult to use Zollner tube on those sort of soft, stickier type waxes, just because it tends to plug the Zollner tube really quickly, and you don't get a great deal of suction left then. So you're always kind of flushing it through. So the Jobson Home was the best option on there. You know, you don't see us nick the ear canal very often, and I think it was just one of those things with this ear canal, unfortunately, but it will heal up really well. So thanks again for watching our video today, guys. I hope you enjoyed it. If you did, then please leave a comment below, and you can say hi to me if you want to in there. We always try and say hi back to as many people as we can. And if you've got a question, by all means, pop it into the comment section below. If you did enjoy the video, then drop us a like if you don't mind. I shall see you again on Wednesday. Have a good couple of days, and see you then.